You might not recognize me with this thick, luxurious beard, but it's Dr. Russell, your friendly orthodontist. This particular video is going to be an opportunity for us to begin a dialogue and how it is that we mitigate this downtime and minimize the delays in your individual treatment. We've been working hard to try to come up with measures, including virtual appointments. We're going to specifically talk about that, but also some of the other advantages that Russell Orthodontics is going to offer to help you and your family get back on track as soon as possible. So stay tuned. We'll get into that. All right, guys, welcome back. How can I nutshell this? There are several classifications of patients as we anticipated, and it turns out to be true. Those that are making progress despite the fact that we have this downtime. We have those who need to see me immediately. They've got broken appliances, for instance, or they're just treading water. Nothing positive is happening. There are quite a number of patients, though, for whom treatment and the current mechanics are actually conferring advantages in treatment progression, whether you know it or not. And we're going to be evaluating you guys. We need to be able to evaluate you guys so that we can identify you that way. Because here's the deal, and I've spent quite a bit of time trying to imagine what it's like on your side of the camera, but it's going to be helpful if you consider what it's like for us. We have a whole lot of patients over a long number of weeks that really need us, and we care so much about you. What we're trying to do is minimize the delays in treatment for everyone, which means everyone has to give a little, not a lot. I don't want everyone to be behind 6 weeks, 8 weeks, whatever it is. And the truth of the matter is, if problems arise, you can be further behind than that. So what I'm trying to do is make the maximum amount of time that anyone is behind is the number of weeks that we've been delayed. And then, relatively speaking, we have a whole lot of patients that go through the spectrum all the way toward hadn't missed a beat. Wouldn't that be wonderful? And we're going to reach out to you on a one-on-one basis and to explain to you where you fit in that triaging system. Because what I'd like to do in the earliest weeks when we're able to come back is to be able to see those patients in the greatest need and then dovetail and feather in based on need and hierarchy of need, all of the rest of you. And so we've got the systems in place. What I need from you is a little bit of cooperation and understanding, and frankly, some feedback, please. Thank you very much. Questions, concerns, suggestions, we're open to it. We're learning as we're going. We're just trying to be proactive with this. There's some advantages though, and let me describe it. You know us to be an excellence-driven, medium-sized, thriving practice, but we're not an orthodontic mill. We actually have room to provide for the following, and I want you to think about this. When we come back, we're going to have a tremendous need to see patients, and yet we're going to need to do it with a much less flow. Whether or not that comes from on high or it's just I'm being proactive and thinking this through, I want the least amount of humans maximally distanced in our practice as possible during the weeks that intervene between where we can come back and when the COVID is gone, whenever that is. And I'm hoping I don't know when it is, but let's just say it's July 4th. So I've always been prognosticating early May go back, and July 4th when they say, you know what, is pretty much a done deal. That's one treatment cycle or one appointment cycle for most of our patients. And so that's my idea. If you can work with me, I'm going to get you guys in based exactly and precisely on your particular situation, and so that we can be caught back up in one appointment cycle. But I need you to help me and work with me. So again, come back, and so we can get into a little bit of the nuts and bolts of how in the world this is going to work. Okay guys, I'm back. Obviously I'm doing this in multiple takes. I want to make sure that I'm communicating well, hitting all the high points. To get back to what some of the advantages are, when we do come back, we have these nice big offices, right? So I'm trying to create a situation where we can be maximally distanced, okay? But also very low touch. I have a no touch protocol. We're gonna talk about that. We're gonna have some videos and explain that very well. But that's just during the intervening time from when we come back to maybe when COVID is just gone. And so that's something that we're gonna communicate about as well. But again, you can imagine how difficult it would be to have all these patients that need to be seen right away and then also have to go low flow. How's it going to work? So all of these things add together for us to mitigate this challenge, and I appreciate your working with us on that. Some orthodontic practices, I'm afraid, are going to be in quite the pickle but not us. Of course, there are going to be hiccups. There are going to be challenges. I want you to help me anticipate that and post comments, questions, and I'll address them, okay? So here is what a virtual appointment is all about and how it is that you can help us help you, help us, help you, help us, right? Virtual appointments. We've established an email, virtual@russell-orthodontics.com. We're going to be scouring the schedule patient by patient, day by day. So in case you wonder, are you going to hear from us? If you haven't already, we've reached out to a ton of folks, but you're going to be contacted, every single one of you, no matter what kind of appointment that you have and no matter when it is that you were scheduled, because of course you might not have been scheduled until deep into May, for instance, already, and maybe we'll be up and running by then and you wonder if your appointment might be affected, and the answer is I'm afraid it will be. Of course, we have a tremendous backlog of patients that have missed appointments, and so we're going to have a strategy for how it is we're going to catch back up, okay? So what we're going to be doing on our end is just working harder, frankly, but we're also going to be working smarter. So let's talk about several categories of patients, and you can go ahead and begin to anticipate how you fit into that spectrum, and then we'll dive a little more deeply into how that might affect you and how it is you can help us, okay? So here's the idea. We have patients that are just retainer checks, very simple retainer checks. They're critical. You know me, I want my excellent results to stand up to the tests of time, and I don't want you messing my work up, so retainer checks are very important in my office. I'm gonna wanna see how it's going. How you doing? We're going to email you. You're going to go to the DIY photos, intraoral photos that we've posted on Facebook and YouTube, and you're going to take some photographs. We're going to reach out to you and you're going to email me some pictures, in that particular case with retainers in and out, so I can see how well they're fitting and whether or not I believe it if you're telling me that you're wearing them like you're supposed to, okay? But for those patients, you don't have to physically come in to actually have a meaningful appointment, okay? So that's great. That's one layer of patients that will not burden others that are in more tremendous need. Also, recalls. We don't want to expose you even if we're following every single possible precaution that we can. We also want to reach out to our recalls and get photographs so I can see what your development is, okay? And schedule you also out past that first little block of time. There are Invisalign patients, you lucky dogs, that are able to progress in treatment because it's an aligner approach. I've done all my hard work in my 15, 20 years worth of figuring out how to virtually move teeth and plan the treatment so that all of that is done on the front end, and we manufacture the aligners. We can provide them to you, and so we've done that quite a bit. And so there'll be many Invisalign patients that will simply be providing aligners, taping them to the window. You can come by, get your sanitized aligners and not miss a beat. That's wonderful. We're gonna schedule you out as well, but I still wanna see how it's doing. So you're gonna be texting or emailing some photographs of your aligners and how well they're fitting, and any questions or concerns, as always. Then, there are patients in braces. Okay, there's a wide range of situations. I want to tell you a really quick story. It'll help you, and I'm going to keep it short and sweet. Back in the day when I wore another hat and worked outside my own office many, many moons ago, there was a patient that came in and she'd been started with another orthodontist, and to be honest, the bracket position was abysmal, and I did it for almost all the patients in this practice, but I took all the braces off and I put them right back on much more precisely with where it is that I wanted them. And I put them in some working wire. So they'd already gotten some advantages to having the braces, but their teeth were all over the place. And I put them in some space age wires. They're literally inspired by NASA, just so you know. Many of you are in these wires that actually go back and trace back to NASA. They're actually thermally sensitive. They're at one particular state, austenitic, martensitic transition. You don't know what that means, but what it means is when you put it up to body temperature from room temperature, it begins to activate and it begins to move and align roots, which is a giant part of excellence in orthodontics. You can line teeth up all day long and whack them off and take the braces off and they don't stay. You know good and well. You ask around to your friends, yeah, my kid, needs braces again. Not in my hands. I mean, it is like 1%. Okay, because I'm thinking about all this stuff. Bottom line, I put the braces on precisely. I put them into some working wires, and just so you know, we don't change wires every time. There might be 4 to 6 wires max for the entire length of treatment. Okay, so you don't get new wires every time. It's just a lot of times when you come in, like, what all can I do? Close that little space, wear that little rubber band, but let the wires work. Does that make sense? So the point is, I put these people, these 2 kids, and they both moved to Mexico and didn't come see me for 2 years plus. And when they showed back up in the office, of course, my hackles were up. And guess what? I took their braces off because it was sweet. Of course, they had some additional advantages going on called no gaps, jaws lined up well, bite in the ballpark, but those wires continued to work despite the fact that I did not see them and they saw no orthodontist for 2 years. Thank God that they were really good brushers. This is the point, guys. I'm going to evaluate you case by case, and I'm going to reach out to you and say, you know what? You actually are in the kind of wires that are continuing to offer advantages and progress even now during this time, and for that first little blink of weeks when we first come back, while we're actually putting out fires and getting people back going that are treading water or maybe even going retrograde in treatment, heaven forbid. And so we're going to explain that so that you have a comfort level with that. But that's my idea, and everyone's a little different. And so to whatever proportion you fall into that particular spectrum, we're going to explain it and we're going to feather you in accordingly. That's the idea. That's why these virtual appointments are so necessary and important, because that's the way that I'm going to be able to provide for all my patients and actually minimize the delays in treatment for everyone. Again, it ranges from gotta get in red hot second to we just scheduled you out to July and you haven't missed a beat, okay? But you might not necessarily know that. We know that, so that's why we're gonna evaluate each and every one of you, and that's why I want you to be paying attention to your emails or a phone call or a text or something so that we can begin that exchange of email from virtual@russellorthodontics.com or maybe even a virtual sort of a thing through FaceTime or Zoom or these kinds of things. And so we're going to identify each of you as we go along as what might be best in your particular situation. So stay tuned, I'll wrap this up, and I think you can see where it is we're going and how this is going to work out for all of us. So this is the point, guys. Not everyone is in that boat. We're gonna have a greatly number of patients that are treading water. I gotta get you in. I'm going to reach out to you, I'm going to identify you as such, and I'm going to say, hey, great news. We've had a lot of patients work with us, and we've been double timing it, trying to clear the schedule so that we can get you in just as soon as possible. And you might anticipate who you are already. But for the rest of you, be open to me explaining to you how it is that you're actually making progress, and I'd appreciate you working with us in terms of the scheduling. We're going to get everyone back up to speed just as fast as we possibly can. So thank you very much for working with us on that. All right, guys, for all of you who are due to get their braces off, have broken appliances, are sitting dead in the water, need to add a few brackets before we can move forward, yada, yada, you are prioritized. Don't you worry. We're going to take care of you, okay? And the truth is, we're on it, like Donkey Kong. It doesn't rhyme, but Donkey Kong, I was really good at that, by the way. And Donkey Kong Jr., and then there was a Donkey Kong 3, but it was after my time. But getting back to the point, here's the idea. Virtual appointments. We're going to reach out to you. Let's get this going together. Let's make this work together. Let's communicate. I want to hear feedback. I want to know our victories and our challenges so that we can address them, okay? And the other thing is, we don't know still, when is this going to be that we're able to come back? We're going to anticipate that we're going to have some low flow, increased distanced, heightened protocols, no touch protocols, types of appointments in the early days. So stay tuned and watch Rosie go through a distanced and no touch protocol appointment. I'm going to post that here in the next day or two, and maybe you'll enjoy that. For all I know, there's going to be some mandates from on high about who can go back to work when and how it is we're going to be able to do that and how many people can be in at any given time. I'm already thinking those things through, so that's what a lot of this is about, okay? The truth of the matter is we cannot wait to get back to seeing you, and I'm thinking about you all the time and thinking about how it is that I can make this the least challenging part of your downtime. I know you're probably going a little stir crazy, a little bit of cabin fever, right? Do something positive for yourself. Use this time. I know you're already doing it, but you're cleaning out closets. Let's maybe clean out our minds. I mean, I'm spending a little bit of time trying to decompress, even though I spent a whole lot of time thinking about you guys. And so I'm going to stay in touch. You stay in touch. Listen out for our requests for virtual appointments. Work with us. We'll work with you. And thank you guys very, very much. Be well.